The results of a study on asymptomatic COVID-19 in children and adults are now out. The study was done in Marion County by the IU School of Medicine, and it shows that it is possible for children under 10 to become infected with the coronavirus and not have any symptoms. Joining me live with more on the results and what we should learn from this, or hopefully to, Dr. Chandy John, a pediatric infectious disease specialist and co-leader of this study. Doctor, good morning to you.
Good morning.
Okay, so let's talk about this. How did the study start? And if you can, briefly tell us what it found.
So the study started as a study of prevalence of asymptomatic infection in Marion County. And the reason we did the study was because there had been studies done, including a study in Indiana, of asymptomatic infection, but it was only in older children and adults, and we wanted to make sure that younger children were included. I'm a pediatrician, work at Riley Hospital. We know that infection in kids may be important, so we wanted to find out, were there any asymptomatic infections across the community, including younger children? And the major finding of the study was that the rate of asymptomatic infection was very low, so that's a good thing. There was only one person infected, but that one person was a 7-year-old child. And this child had no known contacts with anyone with COVID-19. And interestingly, none of the other family members tested positive, nor did they become symptomatic. So there was no evidence that this child transmitted it to other family members.
It is absolutely insane for a lot of us, me, to hear, right, that you can have people that have zero symptoms, and then how it can just ravage someone's body. And that is part of why this study is so interesting, I think, for so many people. And obviously there's so much that goes into that, right, with what is going on inside us and how healthy we are. What do you want parents to take away from this, or just anyone in general, as far as this one child that, you know, could spread it, but maybe didn't in this case?
Yeah, I think that we need more studies to find out over time what is the risk. This was one child we found. If we have a larger group of children, we can look over time and say, what is the risk of a child spreading it to another child or to an adult? Because we didn't see it in this one child, but we have very little data, and there's really very little other data in the United States about this question. So I think that's one thing that needs to be done. But I think there are a few other messages. One is that preventive measures have worked pretty well because the overall prevalence of asymptomatic infection was low. So keep that up, do the social distancing, use masks, do all the things that make infection less likely. And also that there is some reassurance from the child not spreading it in the family, but we can't over extrapolate that. We need more information. So I don't want this to be children can't spread it because we don't know that. We just know in this case that didn't happen.
So it makes sense that you would then want to maybe follow up. I'm interested in how you found this child. And then if you do want to learn more, we only have 30 seconds, how do you want maybe to follow up and find out if more children are asymptomatic or have spread it?
Yeah, so we did this with a group called All In for Health here at IU that has research participation group. So we could easily get a group that was representative of Marion County, which was very important. And that's how we were able to reach this population and find a group that represented the whole of Marion County. And I think the next studies have to be of kids in schools, and that's something we're trying to work with groups now to get funding to study kids in schools and look over time at whether they're infected. If they are infected, do they spread it to other kids, and do they spread it to adults?
All right, doctor, we sure do appreciate it, and we're so thankful that there are very intelligent, smart people like yourself that can help us figure these things out and take us through this. Good luck to you.
Thank you so much.